started with Pyro. Okay. So part of Pyro is what I had shared in the last class. So hopefully today we'll try to finish the remaining part of or the second part of Pyrogenium. Okay. Now before I continue from where I had stopped, what are all the key points of Pyrogenium? Okay, I mean it's mainly the discharges in Pyrogenium are very offensive, good, correct? Never well since septic conditions. Okay, I give you some examples. For example, after abortion, okay, or after any septic condition where you have pus, where you have infection, and since then, if the patient is not better, convalescence after septicemia. Never well since septicemia or septic condition, you can think of Pyrogenium. See, we have many remedies. Never well since pneumonia. Which is the remedy? Kalika. Never well since pneumonia. Sir, I have had pneumonia and since then I am not all that comfortable. And similarly, I was talking to you about never well since viral fever. The remedy is influenzinum, specifically viral fever. Or if it is fever in general, convalescence after fever. Single remedy mentioned in our books is lycopodium. Never well since fever, lycopodium. Okay. So you are right. You know the discharges are offensive. Never well since a septic condition. What else? Craving for pork. And
Ice creams.
okay, aversion to ice creams. Done, good.
Then fever with rapid pulse.
Okay, so we were discussing a scenario, or I gave you a statement: pulse out of proportion to temperature. Pulse out of proportion to temperature. Very characteristic in Pyrogenium. See, in today's class, we are looking at two very important objectives. Now, the first very important objective that we'll be looking at today is we'll be looking at the mental symptoms of Pyrogenium. Okay. So, describe the mind symptoms or mental symptoms of Pyrogenium. That will be our first objective. And the second objective is we'll be looking at a few particular symptoms. I will not typically go from head to toe, but whatever is relevant for a practitioner, for a PG scholar, those areas will definitely try to understand. Okay. So the second objective is we will be looking at the particular symptoms of Pyrogenium. Enumerate the particular symptoms of Pyrogenium. Two very important objectives. Now we'll look at one case. If you remember, when I started with Pyrogenium, I told you I'll be sharing one case from Vijay sir's seminar. When we had attended a seminar in Mumbai, sir had shown us a case of a man, who had bad vitiligo. Okay. See, now I am also trying to share this case specifically here for PG scholars. We never think of Pyrogenium for vitiligo. Okay. Now that's why I wanted to specifically talk of this case. Okay, so this gentleman around 60 plus, he had vitiligo. I am not asking you what are the remedies for vitiligo. You might tell ASF, Soralia, etc., etc. But in this case, what had happened was, he is a big man, and he had he had booked few people. For example, to make things more simpler, he was a producer, and he had booked 3-4 artists for upcoming movies. So when the wife entered Vijay sir's chamber, when sir was asking a little more about this gentleman, and the wife was telling, sir, he hardly has any money. He hardly has any money, but he is going on in a booking thing, like this person for this movie or this lady for some other movie. So he's been just booking. So what could be the thought that comes to your mind? See, you don't have money, but you are into three projects. I hope you are getting my example. Say, I can't go more. I can't go more with the details because it's all recorded. Fine. So we'll have to maintain the privacy of the patient as well. So, but what I want you to understand is, just imagine, we'll modify this case a little. A gentleman who wants to take up new projects. Okay, he wants to take up new projects. Now, as a PG scholar, what comes to your mind when you talk of taking up new projects? Must be you might be thinking of ambitious, okay, etc., etc. But what was the tragedy in this case? This gentleman did not have any money. Okay. Then you might be thinking fancies. Then you might be thinking that he is very imaginative, he is insane, etc., etc. So what Sir took the rubric in this case, and it was an eye opener for us way back, and he also showed us the follow up of this particular case, and beautifully the vitiligo vanished. The rubric Sir had entered was delusion wealthy is. Delusion wealthy is. He has got a thought, what is that false perception that he's got lot of money and is booking lot of people for upcoming projects. But wife knows the reality and wife is telling, sir, we don't have so much. So Sir had beautifully converted this into delusion wealthy is, and Sir had prescribed this beautiful remedy, Pyrogenium, and he had shown us the follow-up as well. Okay. So what we realized, from Vijay sir's case was, what beautifully Dr. Hanuman sir was talking of similia similibus curantur. Okay. So how beautifully a remedy can do wonders when it matches. Done. So that was the important theme we realized way back, that Pyrogenium people feel that our Pyrogenium people have a delusion that they're wealthy, they're rich and they're wealthy. When I talk to you about further nosodes, we'll see an exactly opposite scenario. Okay, the patient will be having lot of money, lot of wealth, but he feels he has got no money. Now what is it exactly opposite? Delusion poor is. Okay, and the remedy which we'll discuss a little while later is Sorenum. Delusion poor is Sorenum. Delusion wealthy is Pyrogenium. This is very important. We'll discuss a little more. So, majority of the mental symptoms that we see in Pyrogenium, they come because of septic condition. They come because of septic condition. Okay. Now, what is that clue you get from this particular statement? So, yeah, you see a lot of mind symptoms. Like for example, you can see delirious symptoms. All coming because of septic condition. Like for example, a person with high fever, he can go into a delirious state. Okay, so we look at the mind symptoms. Now to start with, Pyrogenium can be restless. As a PG scholar, you will be knowing better remedies for restlessness. We are also trying to define the restlessness in Pyrogenium. So restlessness, which mainly seen during fever, restless fever during. Okay, which are the other restless remedies? Arsenic, Restox, Aconite. Okay, you are talking of trios. Good. Arsenic, Restox, and what is it? Aconite. Then any other remedies? Arnica, Baptisia. Okay, Baptisia also comes very close. Stramonium can be restless. Belladonna can be restless. Okay, Cinna, Chamomilla. Fine. Many remedies who can be restless during fever. So Pyrogenium is restless, and Pyrogenium restlessness during pneumonia. You have rubric in your repertory. Restlessness, pneumonia during. The only other remedy mentioned is Restox. Restox. So for example, tomorrow you have a patient who is restless and the diagnosis is pneumonia. So two remedies will come to your mind, Restox and Pyrogenium. Okay. Restlessness because of septic conditions. Septicemia bringing on restlessness. Septicemia bringing on restlessness. You can think of Pyrogenium. Okay. See, another very important thing, one should remember is loquacity. Loquacity. See, many times we see patients when they have a high fever, they start blabbering, they start talking irrelevant things, loquacity. Not everybody with fever talks. Okay, there are few who talk, and it is also your duty to understand what are they talking. I'll just share a small example. Once it so happened in my clinic, the girl was a very small girl, 4.5 years or 5 years old girl. She was telling, Amma, see cockroach, cockroach, cockroach. It happened in front of my eyes in my clinic, and her temperature was 104.4 or 104.6, high fever. And why I am giving you this example is, everybody in fever, they will not talk one. The content can also vary. So this girl was telling, Amma, cockroach, cockroach. And we were worried, where is the cockroach? And I, being the clinic owner, I was more worried because no cockroach in my clinic. I was also a little worried because then we realized that there was no cockroach. Mother searched, I saw, and that's when we realized in fever she is seeing cockroach. You getting my point? In a delirious state, she is seeing cockroach which is not there. Now what is this? This is delusion. So you have a rubric, delusion sees cockroaches. So that's how we entered. And must be phosphorus and stramonium or two remedies mentioned. Okay. Done? And this girl received stramonium. And forget the cockroaches, so anyway it went, and fever also beautifully improved. So delusion sees cockroaches, stramonium and phosphorus. Okay. So loquacity in Pyrogenium, loquacity mainly during fever. Okay. Other remedies? Podophyllum, stramonium, belladonna, lachesis, fine. Teucrium marum. That's also a remedy which has loquacity, fever during. Loquacity, fever during. Okay. And they generally talk more hastily in fever or in or during loquacious state. They talk too fast. Okay. And they keep babbling. Okay. And you also have a very interesting situation here. What is it? Well says he is when very sick. Well says he is when very sick. Recently we had a patient with diabetes for last 3 years. And first time in my life I have seen a case of diabetes last 3 years who has never got his diabetes checked. 3 years back once they have done it and it was very high. Last 3 years till he came to me. I insisted, you please get it done. Now, is it peculiar? You know you're diabetic, your sugar levels are high, and last 3 years you have not got it done. Though my assistant did a beautiful job of taking the case in detail for a few hours, what caught my attention was, boss, you are diabetic and you have not got your sugar checked any time. No sir, I never felt. I never feel I am diabetic. I am absolutely fine. So what is this? So this is this state where there is weight loss, the skin is turning black, lot of things happening in your body. People at home are telling, please come. Daughters are telling, wife, she is pestering him, please come, we'll go to the doctor. Get your sugar level checked. No. Nothing is wrong with me. I am absolutely fine. You people are simply trying and you are forcing me to meet a doctor. I have no issues. Bad weight loss. Okay, and again, the vascularity, the blood circulation to the lower limbs, that is getting affected. And you say, no, I am absolutely fine, I am not coming to the doctor. That's a very serious situation. What remedy should come to mind? Arnika, very good. Arnika. Delirium says well when he is sick. That is the rubric I entered. Arnika, arsenicamal and opium. Arnika, arsenicamal and opium. Delirium, okay, says well when he is sick. He is in a delirious state, he is not able to understand the seriousness. And he says, I am absolutely fine. Okay. So your job becomes easy, differentiate between the 3 remedies and you can prescribe. Okay. Huh?
Pyrogenium is also included.
Yeah, pyrogenium is also included, but pyrogenium, I am talking to you about a rubric delirium. Okay. Delirium says well when he is sick, are these 3 remedies. There is also a rubric, delusion well he is. Okay, there you have few more remedies. Fine. There you can also include pyrogenium. Okay. I started with Vijay Karsa's case. I was trying to tell you about the delusions you have in pyrogenium. So one very important delusion which I will be talking in the end is delusion wealthy he is, delusion rich he is. That is one delusion. Okay. The other delusions that you have in pyrogenium, any vague idea? It's been done during your UG classes. So any other delusions that you can think of? Pyrogenium.
He has many arms and
Okay, good. He has got many arms
body.
and many legs.
Body occupies the whole body.
Okay. Now why is the body occupying the whole bed? So there is a delusion, body is scattered. Okay. Delusion, body is scattered. Fine. And delusion, there are more arms and more legs. Fine. And Haripriya is talking of a delusion. Delusion double his. Delusion double his. And the beauty of pyrogenium, which is a single remedy here, is delusion. If he is sleeping on one side, he is a different person, and if he is sleeping on the other side, he is a different person. Okay. For example, I am sleeping to my right, I am somebody. I am sleeping to my left, I feel I am somebody else. Okay. So single remedy you have in our materia medica, and that is pyrogenium. Delusion existed in somebody else. Delusion existed in somebody else. See, this again a beautiful interpretation, what I learned from Vijay Karsar. So for example, many times it so happens, you feel if for my child is fine, I am 100% fine. Meaning what is this situation? Existed in somebody else. Meaning, like for example, sir had shared one case of a lady who was admitted with severe respiratory infection. Must be tuberculosis, bad case of tuberculosis, and mother was so much attached to the child, and she would feel like, sir, if she is better, then I am better. You getting my point? Okay, if she is better, I am better. Like many times we used to hear stories that the king would keep his life in the parrot. I don't know if your grannies had told this particular story, that a king would keep his life in something else. So meaning you existed in somebody else. I hope you got me right. So tomorrow you have a situation where somebody says, sir, my existence is in her or in him. Okay, if he is fine, I am fine. Okay, again single remedy, and that remedy is pyrogenium. Delusion existed in some other world. Okay, some other planet, belongs to, there are people who talk about past life I was this, that and all. Okay, so that is cannabis. Okay, that is cannabis. Anyway, these are a little higher, must be with your evolution, with homeopathy, slowly you will try to understand things. But you are PG students, and I feel you should know. Okay. You should know, and that's why I'm just giving you a small clarity. Body scattered, tosses about to get the pieces together. Feels as though crowded with arms and legs. This is what Dr. Madhu was talking about. Okay, this is one thing. So which are all the other remedies? Baptisia, absolutely right. It's only baptisia. Okay, you also have it in petroleum. See, petroleum you also have a beautiful delusion. What is that? Okay, duality, and the mother feels, especially after purpurium, that she has given birth to 2 kids. And how do I manage? If you remember reading Kent's, beautifully described in Kent, the lady feels she has delivered 2 kids. In reality, she has delivered only 1 child, but she feels she has given birth to 2 kids. And how do I manage 2 kids? Okay, so that is a beautiful delusion you have in petroleum. So petroleum also has this. Baptisia has this, and you also have it in few more remedies. And one rare remedy is kajuputam. Kajuputam, okay. Delusion, the urine smells like cat's urine. Cat's urine, kajuputam, okay. So you have it in baptisia, kajuputam, petroleum, phosphorus, and of course stramonium. Stramonium, okay. So this is what I already explained. One person, she were lying on one side and another person lying on the other side. And in the brackets you see only remedy in our materia medica. Okay, in our materia medica. And this is the double duality. Not duality, delusion feels is double. Okay, and a very important delusion. Delusion is wealthy, very important. Any other remedies that you can recall? Delusion, wealthy is. There are 4-5 remedies. Yeah, platina, veratrum, and of course sulfur, phosphorus. There are many more remedies in your repertoire. But you can think of plat, sulfur, phosphorus, and veratrum. Plat, you all know, there is always this feeling of somebody great, somebody different. Okay? They're highly contemptuous people. And sulfur, they're big boasters. Sulfur is one person whom you can never trust in life. Okay? They talk all big things. And if you are a Barata and if you believe him, then you'll go for a task. Okay? So sulfur, they talk big, but then you realize that this guy does not have any stuff. Okay? Phosphorus, and even for that matter veratrum. Veratrum is again a big show master. Okay? They keep talking high, big things. Fine? At least, he is aware that he is taking you for a ride. Okay? But they generally talk all big things. Fine? Again, from what I have learned from Sir, they are brand conscious, they are big show-offs. Delusion, wealthy feeling comes from the inner need to show that I am somebody great. Okay, that is Varatana. So, mind of Pyrogenium, we spoke of few physiological things, the delirium, the restlessness, the loquacity, which mainly comes because of fever or because of any septic condition. Okay, and then we went a step ahead and we saw that there are a lot of fixed thoughts, lot of false perceptions, and one beautiful false perception they had is that they are very wealthy, and dual or the double being one side one person, the other side the other person, and body being scattered, bed is filled with arms, legs. Okay, done. In baptisia, you can see a step ahead. What you see is there's a lot of confusion. You might also see in baptisia that they are busy fixing in the delirium, especially during typhoid, high fever. They might be busy fixing their hand to their hand or their leg to their leg, whatever. They feel their body is scattered and they are trying to get it together. Baptisia. Baptisia. Restlessness, wherein you also see Pyrogenium keeps moving. We forgot that. Why are they keeping? Why are they moving? Because they are looking for a soft place. Like Arnica. Part feels hard. And I also told a situation when part feels hot and they keep moving in search of a cold place, that is opium. That is opium. Okay. So hope the mind part is clear. We look at a few characteristic particular symptoms and image taken from Google images. Now what do you see here is, we are talking of headache. Headache better by tying bandage around. Okay? Headache, violent throbbing headache ameliorated by tying something tight. Done? Any other remedies you can think of?
Belladonna.
Okay, belladonna, throbbing headache, okay. China, glonine, fine. See, I mean this specific situation where they feel better by tying tight, bandaging, is argentum, nitricum, pulsatilla, okay. You also have calcarea carb and heparsol. I am giving you the top remedies. There might be many more remedies. You can have a list. Second very important thing is pain in the eyeballs. Sore pain in the eyeball. Better remedies? Sore pain in the eyeball. Bryonia. Gelsemium. Okay. So, eyeballs feel sore. Looking up and moving eyes aggravate. Looking up and moving eyes aggravate. Okay. Now, tongue is something you all know from your UG classes. It is clean. It's fiery. Okay. Shining tongue. Smooth as if varnished. Fiery red, dry, cracked, large. This is how typically it is mentioned in books. Typically it is mentioned in books. Okay. So what other remedies can you think of? Crotalus aridus, Apis mellifica, ferrum, terebinthina, calibyke. Okay. So head, eye, and of course the tongue. See, we have few symptoms pertaining to the GI. Okay. So what is it that you can recall from your UG classes? Stomach of Pyrogenium. What do you have? Huh? Stomach of Pyrogenium. You can talk about the desires and aversions that is accepted.
Coffee ground vomit.
Okay, good. Coffee ground vomiting. Huh? Okay. What other remedies come to your mind? Coffee ground vomiting.
Urine. Coffee ground
Urine. You are talking of vomiting. Huh? Okay. I mean, see, just use your common sense. Why do they have coffee ground vomiting? What is the cause for coffee ground vomiting? Huh? Mainly Ca. Okay, so you can think of some Ca remedies. Like for example, Crotalus aridus, phosphorus, cadmium, Ca stomach. Right? You can think of those remedies which will arsenic amal. Okay. So vomiting in Pyrogenium is coffee ground vomiting, and more important is like two other remedies or like many more remedies, vomiting water when it becomes warm in the stomach. Phosphorus and bismuth. Okay. Opposite to arsenic amal. Opposite to arsenic amal. Coffee ground, very important is this offensive vomiting with impacted or obstructed bowels. Coffee ground offensive with impacted or obstructed bowels. Opium and plumbum. Two more remedies. Lower down, what you see here is, it can either cause constipation or it can also cause diarrhea. Okay, constipation or diarrhea. Constipation, again, when the stools are horribly offensive. Stools are horribly offensive. Horribly offensive stools, painless, sorry, this is the diarrhea part. Horribly offensive, painless, involuntary, and must be there's one more thing that is missing. The color, they are more of brownish, the diarrhea. And it is also similar to the aloes situation. What you have in the aloes situation, what is it that you see? That they have difficulty in holding the stool. They pass flatus, they think it is flatus, but unfortunately stools also will escape. Similar situation you also have in Pyrogenium. But what differentiates aloes from Pyrogenium is the offensiveness. Okay, offensiveness. Fine. So constipation, where there is complete inertia of the muscles, and stools which are black and they are ball-like, and stools which are black and ball-like. Other remedies? Opium, chelidonium, sheep dung stools is what you have in chelidonium. Calicar, okay, alumina, done. Veratrum, plumbum. These are few remedies which will have black ball-like stool. See, you also have stools which are brown or blackish. Stools which are brown or blackish. When you talk of diarrhea. Two small areas you have in Pyrogenium which has to be told, and among those last two areas, one very important area is the female. Okay. Now you can start telling me what do you expect on a female? Huh? Okay, the leukorrhea, the menses, which can be offensive, very good. Think beyond. What else? Okay, purpureal sepsis, good thought. Dr. Mani Lakshmi is talking of purpureal sepsis. Septic abortions, yes, good. Septic abortions. Haripriya, septic abortions. What else? Good. So here it's nothing to do with dysmenorrhea, menorrhagia, metorrhagia. Those things you don't see. What you see here is abortion and after effects of abortion. Retained placenta, or for example, the fetus inside it has died and then it starts decomposing. Okay? Done? And for example, MTP is done and then the mother suffers. Okay? Fever, body pain, pelvic cellulitis, purpureal fever. Okay? Never well since abortion. Retained placenta or a dead fetus inside leading to septic conditions. Okay? Done? So these are few conditions where you can think of Pyrogenium. Septic infections after childbirth, septicemia following a miscarriage with the fetus or placenta retained and decomposed. This is what I was trying to tell you, very important. Purpureal infections, septic abortions, menses horribly offensive, and please make a note of this particular situation. Fever at each menstrual cycle. Okay? So what is it trying to tell you? There is some kind of an underlying infection. Okay? So every time during menses, lady getting fever can be an indication of Pyrogenium. Pelvic cellulitis, we spoke of that. Post-operative cases with sepsis, meaning some procedure is done. Okay, for example, DNC, MTP, okay, and followed by sepsis. You can think of Pyrogenium. Lochia, you forgot this, even it slipped. Lochia, which is thin, acrid, brownish and offensive. Okay? Lochia, which is thin, acrid, brownish and offensive. Okay. So this is the female part. The last very important part is, what is it that we have missed in Pyrogenium? Fever. Good, fever. Okay. So fever, commonly we see this getting indicated in our clinics very often. And many good homeopaths, they might have their own success stories to share when it comes to Pyrogenium. See, one thing I want to tell you is please don't blindly prescribe Pyrogenium for fever. That's the first take home message. Because what Dr. Haniman told was similia similibus curanter. And many times, like me, in the initial days of practice, when I did not know anything, I would have just blindly given Pyrogenium. And it's a big mistake. And with my understanding of homeopathy, I realized Pyrogenium will not cure all cases of fever. And that's what you beautifully see here. Pyrogenium has its own picture of fever. Okay. Only when that picture of fever matches, Pyrogenium works. Otherwise, it will not work. Okay. It will not work. So, what is that picture? First very important thing is fever, pyrexia of septic origin. One. And then the beautiful indication, the second beautiful indication is, you would have studied in your medicine books, PUO, pyrexia of unknown origin. Okay. Second. And third very important thing is, this is the picture I was trying to tell you. It will have its own chill stage, heat stage, sweat stage, temperature, pulse, body pains, and it will also have its own mind during fever. So all those things should match. Only if it matches, it works beautifully. So the focus here is chills in back starts between scapulae. Another remedy here. Gelsemium. Chills runs up and down the spine. Okay. Chills felt in bones. Which is the other remedy? Chills felt in bones. Eupatorium. See, sits by a fire and chills whenever he leaves it. So, he is feeling cold, so cold he is feeling that he feels like sitting near the fire. The moment he comes out of the fire, again the chill starts. Okay? So, this is with the chills. Heat, nothing much. Great heat with profuse hot sweating without relief. Sweat does not relieve. Sweating more at night. Intermittent fever, chill stage, heat stage, sweat stage. Okay. Severe body pain. That's when many times we confuse this to eupatorium. We prescribe eupatorium. Fortunately or unfortunately, the patient might require Pyrogenium. Okay. Severe body pain, skin is dry and burning. And what is very, very important, now the question might come up, sir, how do you differentiate belladonna, eupatorium, gelsemium from Pyrogenium? Now this is what answers your question. I told you in the last class as well. So disproportion of pulse. High fever, but you also see the pulse going haywire. It is not in proportion to the rules. 1 degree temperature, there will be 10 rise in pulse. So that concept is going to be missed here in Pyrogenium. See, because of this high fever, what you also see mentally is, what can happen? They can be very restless, or they can go into a delirious state. And what do you see them doing in the delirious state? They may talk too much, or they feel their body parts are scattered, they blabber, they talk too fast, too hastily, they speak in fever, and this is what you have in Pyrogenium. Loquacity, restlessness and delirium during fever, bed feels hard, body parts feel scattered. Okay, so this is what you have, these are the indications of Pyrogenium in pyrexic state or during fever. Okay. Anything you would like to add in Pyrogenium? Severe body pains, restlessness, thirst for small quantities. Okay, thirst for small quantities. See, main catch for you here is this pulse, very important. Okay. Now the last part will be the modalities. Cold, damp weather, motion, sitting, moving eyes aggravate. They aggravate. and heat, chilli patient, hot bath, pressure, stretching, they ameliorate. Stretching, they ameliorate. Okay? Modalities. Now, the last and interesting part for a PG scholar will be the clinical utility, which you can start contributing from whatever you have understood last class and present class. You can give me the indications. Where can one think of Pyrogenium? See, similia similibus curanter, I mean, anything can happen. But I am asking you about some specific clinical conditions where one can think of Pyrogenium. Okay, pneumonia, PUO, or fever, septic conditions, very good. Huh? Threatened abortions, septic abortions, huh? Pelvic cellulitis, retained placenta, what is it, there can be quinsy. See, I have not told you many things, but I want you to apply quinsy or periodontal, peritonsillar abscess or abscess, gum abscess. Okay, fine. Then bad breath, UTA, bad breath, UTI. Okay, diarrhea, constipation, vomiting, PAD, good PAD, yeah. Dissecting wounds, yeah, good. Dr. Karthik is talking of dissecting wound. He's giving us a clue. Tomaine poisoning, severe gas poisoning, food poisoning. Huh? Yeah, bites. Complaints after bites. Okay, I mean these are few conditions one can think of in Pyrogenium. Okay, so hope you got an idea. We started with introduction, sphere of action, characteristic symptoms in the previous class, and this class we focused exclusively on the mind and few particular symptoms. Okay, any quick questions? Anything to ask or anything to contribute? Okay, so if things are fine, we will close.